Have you ever wondered how surgeons make critical decisions during an operation within minutes? The answer is often the frozen section, a rapid histological method that produces tissue sections for immediate review. Unlike routine histology that takes hours to days, frozen section enables diagnosis in minutes to inform intraoperative choices. Sections must be thin and ideally free of ice crystal artifacts, which can distort tissue architecture and obscure diagnosis. The instrument that makes this possible is the Cryostat, a refrigerated microtome designed specifically for rapid sectioning of frozen tissue. In this video, we will explain principles, key components, the stepwise procedure, common pitfalls, and exam-relevant tips. Before that, subscribe to this channel to never miss future informative videos on medical lab techniques. Frozen section relies on rapid freezing of tissue to create a rigid block that can be thinly sliced by a microtome blade. Thinness is critical. Thin sections maintain architecture and allow accurate microscopic assessment of cells and margins. Ice crystal artifacts form when freezing is slow or uneven and can create holes or distortion that mimic disease processes. Rapid, uniform freezing minimizes crystals. Temperature control in the cryostat is therefore essential to quality sections. Embedding media such as OCT compounds support the tissue during freezing and sectioning and improve cutting quality. Rapid staining methods, commonly quick hematoxylin and eosin, provide sufficient contrast for immediate interpretation by the pathologist. A cryostat is essentially a refrigerated chamber that houses a microtome and keeps specimens at controlled low temperature. The specimen holder, or chuck, secures the frozen block and positions it for precise slicing by the blade. A high-quality knife or blade is required. Blade angle and sharpness influence section thickness and surface quality. Temperature controls, digital gauges, and alarms help maintain the optimal set point for consistent freezing and cutting. Safety features include blade guards, locked chambers, and protocols to prevent contamination and injury to staff. Accessories such as warming plates, cryometting chucks, and spare blades support workflow efficiency in busy operative settings. Step 1 begins with an intraoperative request and correct labeling of the specimen to ensure accurate reporting. Next, the specimen is grossed and trimmed to an appropriate size, removing excess fat or tissue that impedes freezing. The trimmed tissue is embedded in OCT compound and rapidly frozen on the cryostat chuck or a cold plate. Sectioning follows. Thin slices are cut with the microtome blade and transferred carefully onto glass slides. Slides are rapidly stained, typically with a quick hematoxylin and eosin protocol, then covers slipped for viewing. The pathologist examines the slide under the microscope and provides a concise report to the surgical team for immediate decisions. Remember the trade-off between speed and quality. Rapid results are valuable, but poor technique reduces diagnostic accuracy. To avoid ice artifacts, freeze rapidly, use appropriate embedding, and maintain stable cryostat temperature during sectioning. Common technical issues include chatter, compression, and thawing. Recognize these to differentiate artifact from pathology. Safety and maintenance matter. Regular blade changes, clean chamber practice, and correct PPE reduce errors and accidents. Clinically, frozen section assists margin assessment, tumor type confirmation, and decisions about additional resections or procedures. In summary, the cryostat and frozen section provide rapid, actionable information when performed with proper technique and attention to artifacts. And that wraps up today's topic. If this explanation helped you understand the concept more clearly, make sure to like the video and subscribe to this channel for more simplified lab technology and radiology lessons powered by AI. We break down complex subjects in hematology, biochemistry, microbiology, pathology, X-ray, MRI, and diagnostic imaging, step by step, so you don't just memorize, you truly understand. If you have any questions or want a specific topic covered, drop it in the comments below. Until the next video, keep learning smart, keep thinking critically, and keep mastering diagnostics.